uh, muscles, okay, semi-tendinous, semi-membranosus, where they attach on the medial side of the tibia, right? And that medial side of the tibia, especially, there are the attachment point. As you can see, can you see this? This is what we call as the ansa. Is it what is it? Pes anserinus, right? Or duck's or goose foot. Pes anserinus. So we have sergeant, or say grace before T. Say grace before T. So say is what? Semitendinosus. Grace is gracilis, which is this. And then the other is sartorius, right? Semitendinosus, right? Say it again. Say is semitendinosus. Say grace, gracilis. Before T, T is?
No.
Say grace before T, right?
The other is for
Sartorius, say is sartorius, come on.
Okay.
Alright, say grace before T. Say is sartorius, which is this muscle here, see? This is sartorius. Sartorius, say. Grace is gracilis. Before T is semitendinosus. Okay, so say sartorius. Say grace is gracilis. Before T is semitendinosus, or sergeants, SGT. Okay, so all these tendons, they attach to the upper medial part of the tibia, and that is called the pes anserinus, or duck feet or duck foot. Okay, so so that is attached over here. However, the biceps, okay, attached to the lateral, anterior lateral part of the upper lateral, the head of the fibula, right? Laterally, the head of the fibula. Okay, so the function of these muscles are what? Primarily flexion of the leg. Okay, the flexion of the leg, and the ones that attach to the ischial tuberosity extends the thigh or extends the hip. So when the hip is flexed like this, okay, so these three muscles would pull the trunk backwards. They would extend a little bit. So these three muscles, since they attach to the ischial tuberosity, they go down, okay, medially and laterally. Medially, pes anserinus. Laterally would be the head of the fibula. So they would what? They would flex. They would flex the leg, okay, and so when this area is fixed, so they would pull the hip backwards, like that. Okay, they would pull this area, ischial spine, and that's the extension of the hip joint. Okay, that's that. How about the nerve innervation? Semitendinous, semimembranous, innervated by what? Nerve, yes. Tibial nerve, right? How about biceps femoris? Okay, so long head, and so we have two heads, long head and short head. Long head is innervated by tibial. Short head is innervated by common peroneal. Right. So the short head is innervated by the common peroneal. Long head is innervated by the tibial nerve. And how about the hamstring part? So the hamstring part, so hamstring is what? Basically, the adductor magnus, the hamstring part of the adductor magnus. Adductor magnus is part of what? The medial compartment of the thigh, okay? So basically it adducts the thigh, but so it also has the hamstring part. So normally the adductor muscles located in the medial compartment are innervated by which nerve? Obturator nerve, right? However, the hamstring part of the adductor magnus is innervated by tibial. So basically, adductor magnus is innervated by two nerves. One obturator, okay? The adductor part of the magnus is innervated by the obturator. The hamstring part of the magnus is innervated by the tibial. So it's dually innervated muscle. That's one. Second, dually innervated muscle is, the other is biceps femoris, which is what? Tibial and common peroneal. Okay? All right. And then we also have, like, pectineus is also dually innervated, right? Pectineus muscle. It's femoral and obturator, correct? So we have three muscles that are dually innervated. It's innervated by two nerves.